But anyway, so with that, I just wanted to thank you.
Thank you. Thank you.
Thank you so much. Hello and welcome to everybody. I'm excited to talk to you all a little bit about United Way of the Bluegrass, who's been here in this community for about 103 years. We've been here in the Central Kentucky region. My name is Patrice Muhammad. I am Vice President, Community Impact. And Community Impact, from our vantage point, is everything that's front facing, all the work that we do that interacts directly with clients and individuals who may be in need in this community or who may be not so much in financial need that they don't have enough resources, but they may need to figure out how to do better with those resources. That's what we're here to do. Again, let's talk about it. We've been here since 1921, 103 years. On average, we're doing about $700,000 in grants to smaller nonprofits. Many people know United Way of the Bluegrass as a community chest. So we do raise money and we give it out to smaller nonprofits because people trust us to vet those and vet those programs. We utilize our nonprofit partners to primarily do the work of basic needs support. That would be if anyone needs help with food, clothing, shelter, sometimes education, after school programs. That is normally who we're granting money to within our 10 county service region, which you all can see right here. Right below that is VITA. That's a program that I really love. It's our volunteer income tax assistance program. We help nearly 5,000 Kentuckians in 13 counties to prepare their income tax returns. The IRS, this is a partnership we have with them. They let us know what the low to moderate income level is every year. And then that's our target that we're looking to help those individuals prepare their income taxes for free so that they don't have to pay H&R Block. Well, I guess I shouldn't say those other companies. So they don't have to do pay tax preparation. They can keep that money in their pocket. And also the federal government really started this program years ago because they wanted more people to take advantage of the earned income tax credit, child care credits, child tax credits, period, even just having them, not just things that have to do with child care. But every year you all may be surprised at the federal government's definition of low to moderate income. Last year, it was $62,000 for an individual. That's more than 75% of the people in Fayette County fall below that income threshold of 62,000. So many, many more people could utilize that service, and we would love, come tax season, if we're able to spread the word through the work that you all do there at Fayette County Public Schools. 211. Our 211 program we've had for more than 20 years. We operate this free service. 211 literally dial 211 on any phone, and it will connect you to health and human service. We will refer you to any health and human service needs that the caller may have or who you may be calling on behalf of. So again, we're connecting people based on the need that they have. And we have conversation with them to see if we can help them with multiple needs. Sometimes people call in and say they need rental assistance. Then through further conversation, they may express a need that they have for food or transportation. And we try to connect them to those resources and provide the services in some cases. 211, we currently operate in 92 of Kentucky's 120 counties. So our team of professionals on the phone are backed up by a database resource team that they keep that database up to date with which organizations are offering the services that people need most. And many people in Fayette County, since you all are in the schools, may know about our Sweet Dreams project. Every year we help over 2,000 students receive a small gift going into the holiday season. Of a care package that has to do with pajamas and a hygiene kit, like dental hygiene kit. They get a great book. So we're really proud of that program. So those are the main programs that we have here at United Way of the Bluegrass. Are we able to, if anybody had any questions in the chat or anything, can we do that?
Any questions so far? All right. I think we're
We
good to
can
keep
just leave
going.
it open. That way you can just say something if there's any questions. I'll go ahead and pause. So we talked about 211 and our staff works, we are able to take calls 7 days a week, 24 hours a day. Last year, we took over 25,000 calls. We also had over 2,000 incoming text messages and over 30,000 total requests for service. When we think about, oops, I went too far. So when we think about 211 and people calling, as I said, sometimes people have more than one challenge. So what we found was that we needed some way to connect people that sometimes say let me give some examples. So someone may call and say they need rental assistance. And then they say, that's because I'm unemployed. So I need help finding a job. So they need job seeker services. Then they say, well, because I don't have a job, we also need health care, right? So we said that the problem is people need one place to go where we can bring all those resources to them or make warm referrals so that they don't have to travel all over town. Maybe we can bring some of those resources to them or provide rides. So that is how we started that's how we started the Waypoint Initiative. So the Waypoint Initiative is here to solve that challenge, to be one, a place-based initiative, that it would be in the neighborhoods where we're needed most, but as close to a one-stop shop as possible. That's what we're trying to do. So in our neighborhoods that we selected, we chose 40508. We've got 2 locations in 40508. We're in the east end and the west end of Lexington, kind of, we would say, separated by Broadway. And what we found is that in the 40508 zip code, the average income for a household, not an individual, household, is right under $28,000 for an entire household. That is really hard to get by on. However, on the whole opposite side of town in the 40513, the average household income is about $123,000. So that's a huge disparity. And a lot of it has to do with opportunity. So we want to make sure that we're removing barriers and providing people with opportunities to success through our Waypoint Center initiative. So if people come into the Waypoint Center, here's what we're able to do. This is a whole lot of words, bit of a busy flyer. We'll try to go through it, right? So what we do is, first we do an intake and we take time to understand everybody's unique situation, exactly why they're here. Sometimes people are trying to escape domestic violence. Sometimes people are here because they are having trouble paying a bill. Sometimes people are with us because they said, hey, I just got a new job. I want to make sure I'm able to make ends meet, so they come to us for budgeting. So based on that, our staff members are able to give them hands-on guidance so that they can work them through these particular challenges. So now we bring other partners to the table to help them reduce expenses. For instance, maybe they need to sign up with the We Care program with LG&E to help level out their electric bills, and also maybe get some assistance with home insulation, better lights, right? Maybe we need to put them in touch. Maybe we need to put them in touch with Medicaid, because some people don't realize that based on their income level, they may also be eligible for Medicaid along with the insurance that their employer provides. And Medicaid would allow them to eliminate those out-of-pocket expenses. So again, we're really going to take the time to connect them to the right resources to make the most of their income. Then we are always here. If people come in and they need emergency safety net support, we connect people to places like the Nest, Maxwell Street Presbyterian, a lot of the places you all would recommend for people who are in crisis. But again, our goal is really to work with those who are already working or seeking employment, and we're best able to help those people reduce their expenses and potentially increase their income. So the 3 goals and outcomes, I should say, we have from people coming to our Waypoint centers. First of all, we hope that they'll reach stability, that we'll work with them to make sure that their basic needs are met, that they are getting regular healthcare screenings, and that they're able to meet their future needs based on a budget. Then if they stay with us, we hope we can get them into that growth phase where we start looking at things with our partners such as Apprising, that people can come in and we can help them look at their credit score, see if they need to do some debt reduction, pay down some bills, and make sure that we really get them on the road to thriving. And that last stage, we want people to set a goal. What is that goal for yourself and your family? Do you want to, what is the asset you'd like to own? Would you like to own a car? Meaning pay off the car note, right? Would you like to start purchasing a home? All these things, maybe you want to go back to school. We'd like to help people reach some goal, some financial goal. We have a short video, but I'm gonna play the Waypoint video because we're gonna try to keep it short over here. We've got 3 locations here in Lexington. I mentioned East and West End. Here in the East End of Lexington, we were very proud to open in May the Marksberry Family Waypoint Center at the historic Palmer Pharmacy. Some people knew this building back when it was still operating as a pharmacy owned by Dr. Zerl Palmer. And then for a while it was closed. Then Catholic Charities took it over for a little while. Then the city took the building back. And then we were able to receive the building from the city, got great donations, over $1 million in renovation to make the building fully handicap accessible with an elevator on the 2nd floor. Really excited to be here in the East End neighborhood. This community needs so much work. You all have probably heard of Divine Karama, done work with One Lexington. One Lexington has chosen the East End as their next area to focus on. They just started doing community walks in this area last night. And we're really looking to spread the word about the opportunities for job seeker services and home ownership and budgeting that we're able to do right here at the Marksberry Family Waypoint Center, here at the corner of 5th and Chestnut, 400 East 5th Street. Again, we did some big renovations here. We bring community partners here as well. Employers are here a lot of times, people who are able to help with resumes and giving people interview skills. It's really fun to watch people do mock interviews. A lot of people haven't done a job interview in a long time and they need a little help, so it's fun helping them through that. Our Waypoint Centers, we've provided more than 5,000 people with service, referred them over 35,000 times at this point to different service providers. If you all screenshot that at our website, uwbg.org, you can get more information about all of the Waypoint Centers. They schedule appointments. Of course, we take walk-ins. We would love to get calls from you. That each of the centers listed, it'll have the phone numbers. We're in the East End, West End, also Cardinal Valley area. We're inside of Centro de San Juan Diego Community Center. We have a 9 to 5 office there. And our next location will be out of Fayette County, which may not be of great help to you, but we are also opening a center in Jessamine County. There are all the ways in which we hope we can help you support the families there at Fayette County Public Schools.
Thank you. We had one question in the chat. If you all have other questions, keep adding them. But how do we help families sign up for the holiday program, the Sweet Dreams program?
Great question that I'm not prepared for.
That's okay. We can find out and do a follow-up.
Yes, I will get you the follow-up for that. I think there's a sign up. I will find out.
Perfect. What would be the best way for our Family Resource and Youth Service Centers to partner or refer families to the Waypoint Centers?
To go to our website, well, I would say first, I would always say you can always call 211. So that's the easiest number to remember. 211 will always be able to give you the phone number to a Waypoint Center and actually schedule an appointment for you. But definitely, I would tell families to start with 211. And even if they call and just say, I want to go to a Waypoint Center, they will help them find the one that's closest to them and the one that provides the best service based on their needs. Because for instance, our West End location is very focused on housing, helping people move into more affordable housing. Sean has applications for many income-based apartments. He can also help people find help for down payments and things like that. Whereas in the East End and also the Central to San Juan Diego location, we've been very focused on helping people find jobs and making sure that they've got all the soft skills training that they need. So it kind of just depends. And if people need rides, this is a long answer. And also if people need rides, sometimes based on their situation, we do have an opportunity sometimes with bus passes. And we're really excited about a new program we have called Ride United, that by calling 211, they may be eligible for rideshare Lyft rides to and from a location.
Awesome. Good. Okay. This is also a question that you can get back to me on. The Sweet Dreams age limit for referrals.
School, I believe it's all elementary school.
Okay.
But I'll double check.
And is there a flyer about Waypoint Centers that that could be emailed that we could just kind of post and have on site?
Yes, I can send you all a flyer that would have all the Waypoint Center phone numbers on it.
Perfect. And then would the United Way be open to setting up an info table at family nights at a school?
The answer is yes and but. So yes, we don't have staff capacity at the time to get to as many as we've been invited to. In the next couple of weeks, we'll be there. Right now, it's just we're not at full capacity. So by December 1st, definitely we should be able to hit anything we've been invited to.
Awesome. All right. Any other questions for Ms. Muhammad? Thank you.
So I will follow up with a flyer for everyone about the Waypoint Center, and it will also have my personal contact information if anybody's interested or needs additional information. I think I have some team members on with me. Scott Jeffrey, I see him. He is our director of 211. And I think Langston Love is on here as well, who is the manager of our Waypoint initiative, and he manages the 4 Waypoint centers.
Thank you. Mr. Jeffrey or Mr. Love, if you have anything you would like to share, please feel free.
I don't really have, I don't really have anything to share other than I think Patrice did a pretty good job of throwing it out there. But I do, I'm fairly new to the area. I've been here for 8 weeks now, and I do absolutely love it down here.
Welcome.
I think I'm acclimating very well, and I am picking up an accent. So
you'll be one of us before long. Yeah. Well, welcome.
Thank you.
And I hope everyone on the call knows, but we are all at different points in our careers, that 211 is really a resource line when you're not sure where to go for help, to call, and they can help navigate all the resources. Is that a good explanation?
It is also 24/7, 365.
I did not know that. That's amazing.
Yeah, it definitely. So we're there for you all as a resource, but also to pass the number on to families and individuals who may need help after hours. We are here all the time. Well, somebody's here all the time, not all of us all the time.
I hope you get some time off. Yes. And Mr. Love, is there anything that you wanted to add? All right.
Probably not. I think he may be on a computer, on a device that doesn't have a speaker.
I get that. That happened to me yesterday. Mine just wasn't working. Well, thank you so much for sharing with us, and it really helps us to help students and families to know about our partners. So thank you for taking the time. And I look forward to hearing from you, Patrice, as far as the follow-up stuff. We'll get it out to everybody.
All right. Thank you all so much. Thanks for the
Thank you.
invitation.
Yes, have a great afternoon.
You too. Bye-bye.
Have a good rest of the day.
Thanks, you too.